Meanwhile, Nigerian President Muhammadu Buhari has directed the Minister of Water Resources to lead and coordinate with the Ministries of Environment and Transportation, as well as state governments, to develop a comprehensive plan of action for preventing flood disaster in the country. According to a statement released by presidential spokesman Mallam Garba Shehu, the president's directive, which was conveyed to the minister in a letter signed by his chief of staff, Professor Ibrahim Gambari, said the plan should be presented to him in 90 days. Meanwhile, Bayelsa State Elders Council has called on the president to urgently visit Bayelsa State to personally assess the damage the flood has done to life and livelihood in the state. And now join us for this conversation, we have founder RAHI Medical Outreach, Chris Ekiyor, from Benin City, Edo State, Nigeria. He joins me on the news to unpack this latest development. Thank you so much for joining us on the news at this time.
Thank you very much and good afternoon.
Good afternoon. Now, looking at the impact of this flooding all over the world in 2020, we had COVID-19, monkeypox, and now even Ebola virus. Now, what are the modalities to stem the likelihood of disease outbreak of victims of flood?
Flood comes with its own backlash. So first of all, you have a body of water that is highly contaminated. And then when it's in this magnitude, it is affecting almost everywhere, including drinking waters. If boreholes are submerged, waters are mixed up with waters from mold, from septic tanks, from the river, and from flood waters from the forest. And also people bathe in those waters and then drink basin waters. So definitely waterborne diseases such as dengue fever, typhoid fever, rashes, diarrhea, are supposed to be the things that we expect to see. Of course, there'll be an increase in the in malaria infection because there's a lot of water body for malaria parasite, Plasmodiasis, to thrive. So what we're seeing now is a new trend of kind of disease where you have people suffering from typhoid and diarrhea regularly. It's one of the things we've managed with enteric fever. This is worsened by the fact that immunity is also low because people don't eat well anymore. There's no food anyway. So they just manage themselves. Worse still, they drink the same water which the people poo in and pee in during this flood era.
Okay, now what has been some of the strains in reaching people and even giving healthcare agencies, giving healthcare supply to people affected by flood, especially by medical personnel and even outreaches like yourself? What has been the strain or challenges so far?
Okay, so currently I'm running a camp clinic on top of the bridge on the East-West Road between Patani and Adibabri in Bayelsa State. That's where we're able to set up tents and camps where we manage to respond to complement the effort of both Delta and Bayelsa State government, because those areas are cut out on both sides. You're cut out on the East-West Road on the Port Harcourt axis. You're cut out on the East-West Road from the Warri axis. So they are enclosed. The only access to those people is through the riverine areas. The tide is very high. Unfortunately, I don't think NEMA or government was prepared for this kind of thing. I don't know why, because it's annual budgets for those kind of things. In other climes, of course, by now, shoppers will be hovering around and then people are rescued and paramedics and medical agencies are all on ground trying to intervene. I know the governments of both states are doing what they could, but the challenge now is even moving things to those locations. So we must be more proactive in the future. This flood is not something that is going to get away in any time soon. It's going to be a recurring decimal because, like I said earlier in one of those interviews, that we've suffered silting of the River Niger. So it needs to be desilted. So more water will flow in those areas rather than on the flat areas where they are today. Unfortunately, we've seen a lot of things on TV, as it were. Government is trying to make all this effort, but I've been on ground in most of those camps that I've visited. I do not think that what is happening up in terms of what government is saying it has done is speculating to what is done. So there's a gap somewhere that government needs to monitor, either by way of watching people who divert those things or by way of making sure if they are releasing those things as is on the news, it's getting to the affected persons. If you look at what the areas we are, people have no homes. So if you are taking those magnitude of items, the live items to those destinations, you possibly will never have where to put them. So I think government must be more proactive. At this level, we should have, for instance, barges, low draft boats going around and trying to salvage what is salvageable in terms of resettling people and providing immediate medical care, immediate support service in terms of food and potable drinking water. At our little camp, what we're doing is to make sure that when we get those waters from wherever they are, we give them some water cleaning pills or tablet that's able to disinfect at least 20 liters of water per pill, so people can consume those water in the meantime.
Okay.
No source of water. There's nothing anybody can do about it.
Now, what exactly are some of the long-term solutions for people in flood-prone areas? I mean, you talk about the problems affecting these people and disease-borne areas in those particular areas. What exactly are some of the long-term solutions that we can look into?
Okay, so because I live in those areas, I remember in the early 80s, there used to be like dredging regularly of those rivers. I think what government must do now is to reinforce its ecological funds, its excess crude funds, funds for the Ministry of Environment, and then try to access United Nations funds that has to do with flooding, or WHO fund that has to do with flooding, and embark on a proper dredging of River Niger, River Benue, from both tropes all the way to Lokoja down into the Forcados area.
All right.
And allow the boil of the river to be deeper to consume and allow flow. And then government must complete that dam that they've been proposing. I don't know where that dam is. They've been proposing since 1980, whatever.
All right, Chris, from all what you're saying, the government still has a whole lot to do talking about the dam and relief for these people. Thank you so much for joining us on this news program. We'll definitely have conversations continuing on this particular issue. Thank you so much.
Thank you very much.